मेरे ख्याल से हम ही ज्यादा उतावले हैं दोनों।
ऐसा नहीं है।
हाय अपूर्व।
मैं सोच रहा हूँ ये सेम थान में से कपड़ा कटा है क्या, दोनों के कपड़े?
आपके कपड़े रिवील करो सर, देखते हैं।
मेरा तो सेम है जो जैसे मिला हूँ 1 घंटे पहले।
सरप्राइज। ओ सरप्राइज।
2 घंटे पहले वाले सेम है मेरे।
अगर हम दिलीप सर का ट्रेडिशन देखेंगे तो वो आधे घंटे तक आ जाने चाहिए।
चलो, हम लोग कुछ बच्चों के क्वेश्चंस हैं, वी कैन आंसर दोस क्वेश्चंस इन द मीनवाइल।
हम्म।
गुड इवनिंग एवरीबॉडी, टिल द टाइम द किंग कम्स, let me be the pawn to answer things for you. So there are a lot of interesting questions that which are there, which Dr. Zainab can answer, Goga Bhai can answer, because Goga Bhai has seen this app being built from the beginning when we
Where
started.
are these questions on conceptual?
So these are questions related to conceptual medicine, that what all things it can cover
Okay. नहीं,
and
I
how
am
it's
asking
being
where the
built.
questions are there.
Yeah, so these questions were sent to me personally in a group.
Personally, okay.
So is this course useful for PG aspirants who are planning for MD General Medicine? PG aspirants should stick to cerebellum content. That is enough by Dr. Dilip sir. Just stick to that. Okay. So this app is for residents who are pursuing post graduation or any related branches, because there are a lot of allied branches with general medicine now, or people preparing for super specialty, and obviously for MRCP also, because a lot of things will be covered into this which are overlapping. Right? Do you people agree with my answer, Govind sir, Zainab?
Yeah.
Definitely agree. Although one question is asked from the in medicine from the PG point of view, but leave that one question.
Yeah, agreed. I agree. I have completed my MD medicine and want to excel in my practice. So how this platform will help me? This I can help you, because we have been doing this in orthopedics for last. This is our 5th year in conceptual ortho. People joined us in year one. Now they are doing SRship. Some of them are doing fellowship, and they have taken our courses for 9 to 10 years now. Definitely, yes. There are pearls for clinical practice which will be useful, right? So, Gobind sir, you have also taken some lectures in anesthesia, also in ortho. So, you used to tell about a drug called as sclerostin inhibitor that has come by the Dr. Reddy's group, called as Evinity now. The dosage for that is 105 milligram, 2 injections, so 210 milligrams subcutaneous once a month for 1 year. So you have been talking about it for last 2 3 years in your lectures for osteoporosis, and now we have started using. In fact, I completed my 10th patient today with that. We have started using it. So that's there now. So I think when you learn it young, catch it young, when these drugs come, you have a head start. Govind sir, something on
Definitely.
this?
Yeah, definitely, because we keep on talking about the recent advances, and when we say recent advances, usually they come little late in India. So beforehand, the drug being used in USA or other developed countries, and you must be having a great knowledge when it comes in India if you are following these courses.
Yeah. Dr. Zainab, you have been building conceptual radiology. And can you just brief the students, because it's almost the same plan that Dr. Dilip is doing. Dr. Dilip has come. The king is here.
Hello, Dr.
Hi,
Dilip.
sir.
Hi,
Welcome.
sir.
So Dr.
Sorry, sir.
Dilip is
Just
back
now
in
I
Chennai
completed my ENT and
after.
I prepared my PPT and just joining.
Sir, we
So, Dr.
expected that. So that's why we took a head start and we started answering the questions. Uh, so
Already. Okay.
yeah, so I think there is a lot of continuity of students as well, a lot of cerebellum. I can see a few familiar names, who were our cerebellum students and are now planning to take up medicine and, again, taking a head start and joining this, which is great to see. And then about, specialists who have completed MD joining such a platform, I think it's very, very useful for them as well, because, we talk about CMEs all the time. And, whenever we attend a CME, we see a lot of post residency, SRs, and we see fellows. And I think learning never stops. And, you keep getting different perspective from a lot of senior faculty and sometimes younger faculty as well. So, it's a great platform for all of us to collectively learn. I mean, and I learn a lot from the students themselves when we are discussing any topic. I get to learn a lot from the classes myself. So I feel that this is something which we have to do for the rest of our lives, and you never stop learning.
True, ma'am. Yeah.
Dilip sir, I was going through a beautiful Insta post that you had created that spoke about what all you are going to build up in conceptual medicine, right? And different things. And I tried to copy the same and made a reel myself. So what I realize is you have things to stimulate for theory. You have things to stimulate for clinical discussions, your clinical judgment and diagnosis. You have case discussions, and you have already prepared a schedule till November, till Diwali. That is phenomenal. Goga bhai has prepared a schedule for every day till Diwali, and he's got all the specialists for it. And I think this session is more about Dr. Dilip sir. My role was here just to say, sir, Dilip sir, you are going to rock. And
Thank
this
you, sir.
physician, as an MD medicine or DNB medicine, it is the father or the mother of all the branches. We all look up to a physician around the corner. And I'm sure with this app, they will become good physicians, go on to crack INI and NEET SS exams, and pursue it abroad as well. So you are creating a great bridge between MBBS, the society, and higher educations. So best wishes from my side. I think Goga bhai, you can also wish. And then I think Zainab, you can just discuss with sir a little bit how you people are doing radiology and medicine, and then you can align, right? So Goga bhai.
So definitely Dr. Dilip, as I have seen him teaching, so this is definitely going to be a super hit app, and that will be very, very beneficial for the students who will join. And I am very sure they will have a smooth life for these 3 years. They will be excellent teaching, and all the cases they will see there in their clinical practice. They can very easily correlate with Dr. Dilip. I know how he teach. And many of the students are there who have already read from him. So definitely it's going to be a huge hit. All the best, Dr. Dilip.
Thank you,
And
sir.
we will
Thank you very
also
much,
keep
Goga
on
bhai.
following it.
Thank you,
Just
sir. Thank you,
going
sir.
on the lines which Goga bhai said, there are 3 things that you can learn from Dr. Dilip. Number 1, how to be a good clinician. Number 2, at the same time, how to be a good teacher. It's very rare to have both the things. And number 3, how to stay humble, a good human being. So it's very rare to have all 3 things in one person in today's world. So he is a conglomerate of all 3, a good clinician, a good teacher, and a good human being. So all the best. You are going to shine. Teaching can only be done by a person who has a pure heart. There is no adulteration permitted. You have to be like a transparent glass. That's what you are, right? And your dance steps are roaring on Instagram yesterday with Dr. Srikanth on your head, especially. So enjoy yourself. Bye. Thank you very much, Goga bhai. Thank you. Zainab, you can
Bye,
be
Dr.
alone with, you can interact with sir. Thank you.
Sure.
Bye.
Thank
Bye.
you, sir. Sir, you have to be there for at least 2 minutes.
Oh,
I'll
yes.
just share a PPT, please.
Why not? Why not, sir?
All the best, Dr. Dilip. Bye.
Thank you so much, sir. Please, sir. Yesterday
you,
itself I
Goga bhai.
got
You are
sir's
the
blessing.
best.
Goga sir's blessing yesterday itself I got.
Yeah, that was phenomenal.
Great. Bye bye, sir.
Thank you, sir. Sir, I may just need to quit and rejoin. Just
No
give me a
problem. No problem, sir. Take your time.
Yes, sir. 1 second.
So in the meanwhile, I'll just answer a few questions, So how the sessions will be conducted would be, so you'll be having live sessions daily. And by next day morning, the lectures will be uploaded, and all of those will be available for you to be accessed anytime that you want, right? So all of the live lectures would then be uploaded as a recorded lecture. So you can see them anytime you want. So you don't really have to necessarily attend all of the live classes. That's what happens in CR also. The timing for all residents may not match. But, make it a point that daily you are seeing one lecture, right? So you can always see the previous day's lecture which has been uploaded as recorded. So, have that accountability for yourself, that daily I have to see one class, right? So you can always see that at 1.25x or 1.5x, depending on what is comfortable to you. Yeah, I'm also very happy to see all of you. I don't think you were expecting me to be here for conceptual medicine, but I'm just happy that we have this continuity, and I can see you all. We'll be also having a few radiology classes which are relevant to medicine. So I keep meeting you guys, So the timing of live classes, I think it'll be variable, but we'll keep it in the evening preferably. So I think Dr. Dilip will answer that better, but it will differ from one faculty to the other. I hope you guys know the team, so I'm sure he's going to introduce the entire team to you. So, yeah, so the timing is variable because they're live, but if you are planning to see the recorded ones, even if you skip it, you can see the recorded lectures, right? So that's what the recorded lectures will not go anywhere. So you can always see them. The sessions will be variable. It depends on the topic, but not more than 2 hours, right? So I don't know. I mean, Dilip sir sometimes goes with the flow. So I don't think I can answer that. But yeah, I mean, sir, how long will the classes be? Will they go until 4 a.m.?
No, madam. Actually, we cannot do that for residents. Maybe
Yeah.
for NEET PG aspirants, it's fine. But
Yeah.
for residents, anyway, they have to wake up in the morning and go to the wards. So my idea is to finish in 1-2 hours.
Yeah.
That's the idea. So just I'll share because sir has to leave, I think.
Yes.
1 second. I'll share a PPT.
And also, Zainab, this teaching is quite different from the other teaching. It's reincarnation of yourself. You like an eagle. Each topic is very different for the residents. So you have to, reincarnate and come back, teaching simple things. And while
like
interaction
now-
with the teachers,
Yeah. Now the mindset of the student also changes, We have all been into, finishing stuff, completing stuff. Now get out of that mindset. You don't have to complete anything, The learning will never stop. So, try to learn from any and everywhere that you can, everybody is going to teach you something. So I think those of you who are just passed out of your NEET PG now need a very big mindset shift. And plus, you learn a lot from your wards, you learn a lot from your seniors. So don't be eager to, come back to your hostel and read from the books. You won't learn from your books, you learn from your patients, your seniors. So spend as much time as possible. Don't be like, interns ki ghar jaake padhna hai fatafat. So that attitude needs to change, right? So get out of that mindset of completing, reading, you have to learn from wherever and everywhere that you possibly can. Sir, please take over.
No, madam, no. Actually, I was just listening to you. Anyways, guys, like official welcome to Conceptual Medicine because we are launching today. And first, I need to tell the people behind the dream. Who are they? First of all, yes, of course, cerebellum is the backbone behind all this. If I have not been in cerebellum, this would not have been possible for sure. And definitely the man who's smiling on the right side. You can see him. He's the one who's the reason for most of the things happening. And for this also, he's in fact the only reason. Maybe if he has not persisted on this, I would not have been even thinking about this, because I always think of like doing less work, honestly speaking. But sir is the one who keeps motivating how to run. And I don't know how energetic he is full time. I mean, even yesterday when I saw him, I was actually quite upset for various reasons. But when I saw him yesterday, I don't know, for somewhere he brings that energy. I don't know how. And I couldn't understand the real reason behind, this thing behind it. I couldn't understand how he can be so energetic through and through, day in and out. So let it be motivational, let it be energy. So that's why, like,
they will take up orthopedics. They would leave medicine after that.
no, sir, I've seen a lot of orthopedicians, sir. That is, I mean, the aura you create is something very different, and everyone will agree with that. And I'm not the only one to say that. I think there are hundreds and thousands of people who would have said that to you. I'm just a student of yours. That's it, nothing more. An inspired student of yours. And of course, this photo I want to share. I think even Zainab ma'am was a kind of like inspiration on how to work hard to start with. And everyone in cerebellum is an inspiration on how to work hard. And they bring something to the table. And I feel like it's not just one thing. They bring everything, in a sense, inspiration, how to work hard, how to be focused, how to be dedicated on what you're doing. So that's the reason, like, I don't have everyone's individual photos. Like, these are the few photos I had. That's the reason I shared only these few photos. Otherwise, I'd have shared everyone's individual photo, right from like a Shrikant Verma sir to Smiley ma'am to everyone. I should have shared, honestly, because everyone teaches me something. But because these are the only photos I had with me in urgency, like, I just shared these photos. But this was one of my wallpapers for a very long time in my phone.
This
So because
photograph will always be special to all of us.
yes, very, very special because I met Zaina ma'am for the first time in Chennai. So
Yeah.
that's a very good photo. And second, like always, like whenever Apu sir is nearby, it's always a very humbling feeling.
It
I
was
thought I was a tall person until I saw this picture. And please change, sir. Please change it. I'm feeling very short.
No, no, no.
I
Maybe you're just talking about the height, but you're not talking about the real weight you carry.
Dilip sir, she's telling you about what Tendulkar and Bradman are. Just reminding you, right? That's how the
No,
Yes,
sir.
sir.
I
Yes,
think
sir.
it shows how gracious you are, to start with this. And this is your day and this is your platform, and this just shows, what you are made of if you start with this, and you start with the gratitude to the team. I mean,
No, man, no. Actually, I don't know, but I've learned all these things from sir also, because every time if you start sir, how he starts, he never starts with himself. If you see, he always starts with the team, or if he starts with the other person who is about to introduce or whatever. So obviously, like, if I'm not doing at least this, like, what is the point in telling I'm a student of sir?
if students learn this, na sir, that they have to value each other and they have to value from where they have come. There is no limit where they can escalate to. Each one of us, if we just remember to take care of each other as doctors, that's the most important thing. If doctors are with doctors, we can absolutely be into a very good arena in the world. That's what I always feel.
That's the reason yesterday I said the cerebellum doesn't only teach subjects, it teaches values.
Yeah, I agree, sir. With people
Hopefully,
like Dr. Gobind and Dr. Vivek sir and Dr. Praveen, Dr. Sparsh,
everyone.
all our seniors. We three are the youngest.
And Vivek sir, like, every time, Goga sir is like a different Josh altogether. Like, he gives like that positive vibes. He's like, Maza aa gaya. That kind of vibe is what he gives.
You said maza aa gaya?
sir is ready to record Hindi lectures now.
Fantastic. So I think students are waiting to listen
yes.
to how you're planning it, sir.
Okay. Okay, sir. Okay. I'll just walk through. So, I mean, these are some of the good things to share. I mean, I have lots and lots. I think definitely not more than what Zainab ma'am gets, but I do get some things like this. And if you see on the left side, this is a student who has posted about his NEET PG rank and the INS 80 rank. This is, in fact, I've been in touch with so many students. Every time when somebody texts me in Instagram or Telegram, I make sure that I reply them at least 95% of the times, unless until I'm too busy. So this guy was a cerebellum student, but initially he studied medicine from someone else, and then he shifted medicine to cerebellum. And then he was like continuously asking doubts, and doubts. And he was always having a doubt that whether he will crack or not. So I was consistently motivating him. Finally, here he is. So he got a 737 rank. And with the contents he had, he was expecting around 300, 350. But he said sorry that he got 737. So that's one
That he
student.
gets at 350. He'll get everything that he gets at 350 at 737.
Yeah, same, sir, same. I replied the same thing to him. So that is one of the students. There are a lot of students like that. Just I put that random post. And here is a guy who has completed MBBS, and he's in now like residency, and he's subscribed for conceptual medicine already. If you look at it, he was like
Wow.
following my classes since third year, and he's even now following. He got a 158 rank, and 2 days ago he sent a message that he has subscribed. He's one of the first students to subscribe to conceptual medicine, and that's another spectrum altogether.
That's your
The
addiction.
third spectrum,
Addicted
this
to
is a
it.
guy who's practicing. Third
Yeah.
spectrum. So this is a resident, this is a NEET PG student, and this is now a student. I mean, this is a practitioner who is practicing right now and is still following the lectures. And to get these words like you are a Drona and all those things is something that we earn for every day. And I think teachers can really understand like how beautiful is the feeling that we get when somebody tells you something like this. On the right side is a patient from my practice. So we cover all spectrums. So why I showed all this is because this is what we wanted to build in conceptual medicine. We want to cover the basics. We want to cover what is important for the resident. We wanted to cover what is important for the practitioner. And we also want to teach values of how to become a good practitioner.
Yeah.
So that's why I put these 4 reviews. So this is what I wanted all of them to become.
Beautiful.
And so it's not just me. So everyone has to become something like that. So even better than me, that's what I want.
Future is sealed. Future is sealed, Zainab. Conceptual medicine will be the best amongst all the conceptual platform, no doubt about it.
Thank you,
If
sir.
we never thought of
Yeah.
combining 4 things,
Yeah.
Fantastic. Fantastic. Sir, thank you very much for
Thank you, sir.
keeping us in your talk. As Dr. Zainab said, starting on a positive note.
Yeah.
I think if students only watch this much portion, they understand what is medical science and how it grows. Medical books, all the books are basically based on researches and studies and combination. And the studies are based upon valuing each other and working together. Fantastic, Dilip sir. And
Thank you, sir.
keep watching your lectures because as an orthopedic surgeon, you cover a major spectrum for us. So we'll keep on seeing and getting abreasted with whatever you create. And I'm
Thank
sure
you.
Dr. Zainab will keep on contributing to this and keep on guiding.
Obviously, I have no plans of leaving her. Only
I'll
thing
try my best, sir. I'll try my best.
only thing is she's limited by time, I know. And of course, like she's not limited by energy, but she's definitely limited by time because she has got only 24 hours, poor soul.
No, sir, it will be my pleasure. And I think the intent is beautiful, and that's what matters. And it was a great start to this entire thing. We thought that it'll be about medicine, it'll be about the lectures, but the way you've started, I think you've set up the platform for something very beautiful, way beyond academics. So that's great to see.
All the
Thank
best. Best of luck, sir.
All the
Thank
best,
you,
sir.
sir.
All
Thank
the
you.
best to the
Thank you.
students. You are gonna have a great time. Enjoy learning and keep the right attitude and be kind and compassionate to each other. And everything is gonna be very, very well for you. All the best.
Thank you. Thank you. Bye, bye, bye. Thank you
Thank
very
you,
much.
sir.
Bye.
Thank you, madam. Thank you. So, guys, we are going to answer some of the questions. I think students did have some questions. So let us answer the questions. Yes, bye to both sir and ma'am. Thank you so much for both of them for coming and gracing the occasion. And so these are the questions I'm going to first do. Then I'll take up some more questions as well. So first question that students keep on asking is what books and what sources you're going to use. Of course, the topics are going to be kickstarted from Harrison. Almost the lectures will be sorted out from Harrison only. But inside those lectures, you will find things that are much more than what Harrison has to offer. So you'll be getting points from various standard textbooks and you'll be getting latest updates from journals. So that is how we are trying to build. So we're not just going to use only Harrison because we know that right now the 21st edition of Harrison is almost 4 years old. So we are not going to give you the same old data. If there is any updates relevant to that field, we are going to give that updates as well. So the books and sources is going to be Harrison plus the standard textbooks and of course the journals. So second question, will it cover practical? If so, when? So we definitely have idea on covering practical cases also, and we are not going to leave you for sure. So first our idea is to complete the theory by March or April. Then in the May, June time, we are planning to cover the practical part also. So where there will be case discussions. And in case if you wanted to be a little more ambitious in the first year itself, we'll be doing some live demos on how to examine also. But that's a far shot. But at least what we are going to promise is that there will be case discussions for sure. So at least for the common cases like paraplegia, quadriplegia, and abdomen case, respiratory case, cardiac case, congenital heart disease case, everything will be covered in depth. So no need to worry about practical. The cases will be done and whatever questions that will be asked in exams will be done as well. And the third question that we often tend to get is MRCP preparation. So Prachi will answer those questions later on. So the DNB or MD kind of a thing. But let us finish off these questions first. Then if you have any questions related to the conceptual medicine, first we'll finish off that. Then maybe at the end we'll discuss other things. Like anyway, I'm there. Don't worry about it. I'll be answering most of your questions. And what about the MRCP preparation? So whether this course will be useful for MRCP preparation or not? Yes, of course. In fact, one of our dreams is to branch it out and get a separate MRCP course. But as of now, we are all limited by time. So we are all so busy. So definitely we'll be aiding you in MRCP. So definitely this course will help you in cracking a lot of MRCP. So being a guy who have cracked MRCP myself, I know what are the questions you're going to get. And most of the teachers in Conceptual are also MRCP qualified. So they know what kind of questions you're going to get in MRCP. So it will be done, but to crack MRCP, you need to do the NICE guidelines. The NHS guidelines are very important. The NICE guidelines are very important. So that extra edge, whether you're going to do that extra mile or not, time will tell. So once we get sufficient number of teachers, then maybe we can add MRCP as an add-on program also side by side. So no worries about that. So we are on target towards MRCP as well. So what about NEET and the INISS? Will this be helpful? Ideal time to prepare. In fact, the main reason of Conceptual is not only to give you a good base, it's also for NEET and INISS. So every single teacher will strive hard to get the points that are important for NEET and INISS. Yes, it will be helpful. Of course, 100% it is for NEET and INISS. So you can boldly prepare for that as well from Conceptual. And what is the ideal time to prepare for NEET and INSS? I would say it is during the second and third year. In the first year of your residency, it's always almost the basics that you have to be strong. So definitely for first year resident, Conceptual will be helpful, but for second year and third year, it's going to be more of a NEET and INSS kind of a preparation. So that's how you can split Conceptual into 3 years. So some students have been asking, academics are poor in my place, whether Conceptual will replace that academics or not. So bluntly saying, no platform can 100% replace the academics that are happening in the hospital. That is practically not possible. So no online platform can bring that kind of academics into the screen digitally. So we can try as much as possible, but in case if the academics are poor in your center, poor in your place, then definitely those are the people who have to rely on Conceptual, because this is something that's going to bring a whole new experience. It's not just about the points or understanding. It's about like what you have to do in practice. What is the next step? What is the best step? How you work up a case. That's how we are planning to get the lectures done. Will it help in your practice? Just for gaining knowledge? Yes, of course. Why not? So even if you are a person who has completed MD medicine and you are practicing, you don't want to pursue DM, and just for gaining knowledge, yes, because this is something that's going to provide an up-to-date information for all of you, and will approach to common cases be discussed. Of course, yes, if you look at today morning's case of the week series, I posted on case of the week. So where I was talking about a very common case, that is the CML, chronic myeloid leukemia. And just have a look at that case. We have not only discussed about CML, we have discussed about how to diagnose it, and we have discussed about what is the peripheral smear finding. Then we have discussed about what treatment the patient was on, what side effects that patient was developing, and we have discussed about the details of side effect of other tyrosine kinase inhibitors. And then we have discussed a lot of things in that like 5-10 minutes video. We have covered a lot of things. So, and that is going to be there forever. So there will be a case of the week, there will be ECG of the week, and every single week I'm planning to put an ECG. And it's not just a superficial ECG discussion that we do for undergrads. It's going to be an in-depth discussion on ECGs with every small, minute fluctuations that you see in ECG, why you see that, and what is the significance of that. Everything will be discussed. You will understand once we release the ECG of the week tomorrow, how beautifully we have covered, like in 5-10 minutes, one entire ECG. Each ECG will teach you something. So that's what I'm going to do. Because as a practitioner, as an MD physician, you cannot like go through your life without knowing the ECG. Through and through, you have to know the ECG. So that's why we are going to make you make sure that you are masters of ECG and not just learners of ECG, masters of ECG. That's what my idea is. And will this be helpful to JR1? The biggest question is whether this will be helpful to JR1 was time constraints, because people have been asking whether in the first year of residency, whether I'll be able to read Conceptual or not. So remember, however hectic your work may be, I am always a believer of you can make time if you wish to. So for example, I'm a person who is practicing in and out. I record videos daily. You can see the green screen behind me. I take live lectures for cerebellum. I answer questions to students in Instagram. I spend time with my family as well. But at the same time, I do read daily. So I can show you. If you be with me, I can say I can read. Same thing I do during my residency also. Even if I was a first year JR, even I had 2 continuous admission days, 3 continuous admission days, still we do find time to read. So it's not about time constraint, it's about the will to put your effort or not. So if you're not going to put effort as a first year JR, you will never put effort as a second or third year JR. My mother used to say one thing. Somebody, if he's giving when he has money, he will give money even if he doesn't have money. So attitude is what matters. So we often criticize people who give money, right? So we say like they have money, so they give it. I don't have it. It's not like that. So if a person who's giving when he's having, he's supposed to give when he's not having also. Same thing goes with reading as well. If someone is reading when he is in a crunch situation, he will definitely read when he's having time. So try to read as much as possible as a first year resident itself. So don't tell excuses. Even if you get half an hour, 1 hour time, try to do something in that. Try to get something out of it. Of course, you need your free time as well, but don't procrastinate. That's what I'm trying to say. You will find time. Don't worry about it. So just keep reading, and it's definitely useful for first year JR as well. So all conceptual lectures are going to be maybe hardly for 1-2 hours, and we are not going to burden you more than that. Yes, need PG I do take for 8 hours, 10 hours. So that's different because we need to complete all the portions in a short span of time, like maybe 10 days is what I'm going to take medicine. So I need to cram everything in that 10 days. So I take 8-10 hours. But here it's not going to be more than 1-2 hours. It's going to be spread very nicely over a period of time. Our idea is to complete, say the goal is to finish maybe by March 31, but at least by April 30. So to finish all the portions by that. So that is what our goal is, so that students can write the NEET and INISS as well. So that's little bit more ambitious to cover all the topics, but still we are going to do that. And I'm going to give the entire schedule maybe by next month. So right now I'm behind all the teachers. So it's a preparation phase, I know, but still we have put a schedule till November 1. But I'm going to give you the entire schedule, most likely. Then you might get the entire schedule by March 3rd. By the end of September or October, most likely. So don't worry about that. I'm here. And there might be slight variations in the schedule. So people might be asking about that as well. So there will be slight variations in the schedule. Okay. Because of the teachers. But anyway, so that's the same thing. So NEET test is on, yes, I'm aware of that. So it's on March, but we are talking about the next subsequent year, because we are starting only in October. If you have started in last academic year, so we could have done that, but that's why I said like March 30 is going to be the deadline for us to complete. That's over ambitious considering the number of topics we are having in MD medicine, because MD medicine is like an ocean. So, but we will try to finish by that. Don't worry about that. So that's what we are trying to finish by March 30, if I'm not wrong. And what I was talking about, yeah. So mock exams, yes, definitely there will be mock exams. People have been asking about whether there will be mock exams or not. So we're planning for 2 mock exams. Like both will be like kind of MD level exams only. So it will be of 200 questions, all the domains, just like what will be asked in your NEET SS. And it will be like on par with the INISS pattern as well. It will be quite tough also. So you can expect mock exams by February most likely, or maybe even by Jan end. So we'll discuss based on when the notification comes for the exact date. Then what about your future plans by the team? So there are a lot of future plans. As I said, one of them is going to be the MRCP stream. So we are planning to do that as well. And Jatin Goyal is asking 1500 MCQs in the QBank be enough. So first try to solve the 1500 MCQs. Have you seen the question of the day today? Jatin? How was it? How do you feel? How do you feel the question quality is? That one question had taught you so many things. That's what I'm trying to say. Like, first, think about that 1500 questions. They're going to be of extremely high quality. But again, our target is to create a QBank of around 4000 questions. So you will see that. So that's why you see, initially we cannot be over ambitious. Okay, we cannot be like over ambitious, like to create like 10,000 questions. And if they're one-liners, it's not going to be of that much help. So that's why we're going to create very high quality questions. So initially it will be 1500, but trust me, within a month, it's going to expand to 4000. Okay. So what are the future plans by the team? So I said that one is the MRCP stream. Second is, of course, like we are going to bring in more values like the practical classes and all those things. So things will improve. and there will be so many things. And I'm telling you, so what the price that you're giving for all of these things is an absolute steal. Like I don't know. So anyone can give like so many things at this price with so many people around, so many like great people who are going to come and take lectures. And I mean, I've seen their lectures personally. That's why. So the people I've selected are not only kind of like young guys. No, yes, some people have asked like these guys are not like known to me before. I mean, they are not known to you, but they are known to me for long, and I have seen them taking classes for long, and they are like fantastic guys. You will see that. You will see that. Yeah, I'm telling you, you cannot beat this price. It's one of the best prices for the quality that you're going to get. Yeah. So let me introduce some of the faculties. And there are more faculties who will be introduced in the near future. But one of the faculties, everyone. So he is Dr. Vishal Gabale. You know that by the tag name Health with VG channel is so popular. And everyone knows like his teaching style. So, I mean, everyone must be a subscriber of him. So you have subscribed to his channel as well. So he's going to take emergencies for us. And of course, we are into like taking more lectures from him, but he's also limited by time. So we are right now going to move with emergencies from him. It's a very, very good guy, fantastic guy, excellent teacher, and you're going to love his lectures. Next, this guy is like my personal favorite. He's an extreme hard worker. He's also having a very famous Instagram channel, Neurology Snippets. Excellent guy, very down to earth guy, fantastic teacher again. Like lots and lots of knowledge he has. And the biggest ability of this guy he's my junior actually, but yes, he's doing DM Neurology final year. He's about to complete, and he got multiple gold medals. And look at his achievements. Like he's INSS rank 3 and AIMS Neurology rank 1. And he's right now doing it JIPMER. He's about to complete. And I don't know, you just can blindly trust his lectures. He's like such a brilliant guy. Like he can just teach neurology like anything. And she's Dr. Uma Lakshmi Premnath. Everyone knows like about her. And if you are closely following me, so she's the one who's going to take gastroenterology and hepatology for you. And she's going to cover all the topics in and out. And Dr. Suvrat again. So again, a fantastic guy. He's a gold medalist in rheumatology. He completed his rheumatology in SGPJ Lucknow. Again, his qualities and virtue are like too good. And he will be taking the core clinical rheumatology part. Maybe the basic rheumatology I'll be covering, but the core clinical rheumatology is something he's going to cover. And again, another junior of mine. Again, she's my very, very good friend. And Dr. Priyadarshini, like good knowledge, and she's been a consistent hard worker throughout her MBBS, MD, as well as during her DM endocrinology through the years. And she's the one who's going to cover all the endocrinology topics. And you will love it again. And again, she's my senior. I used to call her Ma'am, Suganya Ma'am. And she's working with me in my hospital. I cannot even like put her accolades here, like because this is the maximum I can put because she is having so much. So I need to put a separate placard for her accolades alone. So she's such a good teacher again. And she'll be taking nephrology for you. And there is another nephrology faculty who's coming up. So I'm not announced him, is Dr. A.S. Nath. So you will be getting to know about him maybe in the near future, maybe by tomorrow or day after tomorrow. He's also like kind of a gold medalist. And these are the schedules for the in-app live sessions you can go through. There might be, again, I'm telling you, there might be slight variations. So because of the commitment of the teachers and the faculties, especially me, because maybe you can argue like initially why you're not taking so many classes, because this is the time where we need to do the NEET classes. So that's the reason I'm not taking that much classes right now. But as time goes by, I'll be doing more and more classes. Don't worry about it. So initially I'll be doing less, yes, maybe 1 or 2 classes, and in all topics, people are asking like what topics I'll be covering. Predominantly, I'll be covering all the systems, but not all the topics. The most important topics, I'll be doing that. So in case if you want some topic from me, you can always request. Again, with time being on my side, I can do any topic, not a problem at all. So anyways, I mean, these are the schedules. I mean, the most important thing is we have to form the schedules. And some student has asked like why you're taking cardio, neuro, nephro like that. That's how it has to be, because this is a PG course. This is a course for MD medicine. I cannot ask a cardiologist to come and take 15-20 days of cardiology and complete cardiology in 20 days. It's impossible. How can a cardiologist will agree? Even I cannot do that. So we are all practicing people. We are all like practicing somewhere, we are having hectic time schedule, and it's very difficult to manage our time. So that 1 to 2 hours of lecture itself is going to be very tough from a guy who is practicing day in and out and who's having like very hectic OPD and IPD. So it is not possible. So, but what I can assure you is you will be getting an index in the app. So you can see like what are the topics that will be discussed, and that will be done as time goes. And that index will be mostly from Harrison. As I said, all these topics that we have uh, put here are all actually from Harrison. And some of the basic concepts also will be discussed. So you can ask me like why Dr. Devyani. So Devyani is an excellent microbiologist. Why she's taking classes? Because before going into infectious diseases, so you have to know the essentials of microbiology. So she'll be covering what tests to order, what should be expected in a patient with a probable bacteriological disease or a virological disease or a parasitological disease. So those are the basic things that we'll be doing in infection. Then we'll be going to the advanced concepts. Likewise, we have teachers like Dr. Pooja who can take a bit of physiology as well. So we'll be having like so many faculties who will be doing their best. So it's not just about one, you're going to get the best of everyone. Imagine you're getting lectures from 30 plus faculties, 25, 30 plus faculties, right from physiology to radiology, Dr. Zainab ma'am is taking, and some office orthopedics. I have a topic called office orthopedics, Apurv sir will be taking, and biostatistics, I'm expecting Vivek Jain sir to teach again in conceptual medicine. So he'll be teaching what statistical knowledge that's important to do the thesis and all those things. So there are so many things that are lined up. It's beyond your imagination. In fact, it's beyond my imagination as well. We are actually putting so many things together. Okay. So you not worry about it. And what book somebody is asking. So what book should we buy and how should we make notes along with these classes? So book will be technically Harrison. But see, the teachers will be helping you regarding the journals from where they have quoted and some very important landmark trials they're going to say. So no worries about that. So right now you can just trust Harrison, but teachers will be telling. So where they have taken this point from, which book to read, which chapter to read, and all those things. So no worries about that. And whatever PPTs that they are taking, that will be uploaded in the app. So no worries. So that is the kind of the notes that you can expect. And you have to slightly move from the NEET PG kind of a lecture, because in NEET PG, what we do is we chalk and talk most of the time. So here also there will be some chalk and talk method, but it's virtually impossible to crush entire Harrison and write it on hand. And it will be boring for you also. So there will be a combination of a PPT and writing, both together will be there. So, and that's the best way, according to me, because utilize time in the best way. That is the best thing to be done. Okay, fine. So let me tell you the schedule. So we have done the schedule till November 1. Till November 1. So our pre-recorded lectures are, you have to decide, man. I mean, always I'm a believer of live lectures generally, because live lectures give you more insight, because we'll be able to discuss more with the students. That's why I'm always a believer that live lectures are going to be the most important. So rest is up to you. So pre-recorded, that too as a resident, I mean, my honest opinion, if you have pre-recorded lectures, I've seen, I mean, I had a previous app of my own. I've seen only hardly 2-3% of the residents watch pre-recorded lectures. But when I took live lectures in the same app, almost like 1,200, 1,500 students are attended. And in that 800, 700 students are residents. I mean, that's the reason, whole plan behind this live lecture thing. If we want to do a pre-recorded version, then we probably would have released next year also. We would have all the teachers record and then release the videos next year. But we wanted to do that live lecture format, because as a resident, like that live lectures always give a kick. Whenever you listen to someone on face live, so that always gives a kick. Pre-recorded lectures need a lot of motivation, because you have a pre-recorded thing, you always feel complacent. You can watch it anytime. And residents, as a resident, generally, I feel like I wouldn't be watching a pre-recorded lecture unless until I'm in a huge pressure to learn things, or maybe I'm going for an exam. Otherwise, in first year, second year, most of the students will be like, I'm feeling tired, or maybe I'm very busy, I'll not be able to watch it right now. So I'll watch it later on. Okay, fine. So what I was telling is, like, till November 1, we have done the schedule for now. So as I told, like, it's a phenomenal achievement. Even before starting the app, even before registering to the app, you get to know that you have a schedule till November 1. That's 1.5 months of schedule. That's what we created. And trust me, it took honestly like 20-25 days to get this done. just because these are teachers who are extremely busy. They are not like what do you think? And it's virtually impossible for me to get the dates till November 1, but we have done it. Here we are. So what I can do is like I can get the lectures till February or March, and I can put the schedule by September itself. That's something I can promise. So you will get the schedule till March or maybe at least till February. So no worries about that. We're not only going to release for that month, we are going to release for a long run also. So as I said, there might be minor changes. So excuses for us because these are teachers, they might have their own plans. So there might be some small changes. Otherwise, I don't think there'll be any major changes. You will be getting the course completed on time. And you can ask your questions now. So I'm open to it and I'm all ears. For someone taking a plan longer than 1 year, will the live lecture cycle repeat? So yes, we are planning to repeat the live lectures. It's like every year it will be continued. That's the current plan. So we'll see to it. Right now, it's the plan. So even if you take for 3 years, it's going to become a cycle. And we'll be, I mean, maybe with every moving edition, like it's going to be more and more updated. And maybe we'll try to limit whatever limitations we have. So that's how everything grows. And that's natural. And there will be a repeat cycle for sure. That's what we are planning. That's what our aim is. Will there be sessions for DNB theory in practical? Like we have orthopedic? Yes, of course. Like I told you, there will be practical sessions, and practical sessions will not only be useful for your MD board exams, it will be used for DNB board exams also. So in case if you want to suggest something, you can always suggest to me. If it's good, we are going to implement it anytime. Because this is something for the students by the teachers. So definitely we are going to listen to you. I wasn't able to watch your main revision videos from Cerebellum as I did from other app. Do I need to watch those main videos and where I can watch them? So main revision videos, I mean, you have to subscribe to Cerebellum. You can watch any video anytime. Timing of live class, it will be after 6 p.m. So it depends again on the teacher. So, but we are trying to finish it before 9 p.m. So the slot will be from 6 to 9 p.m. somewhere. So sometimes it may go till 9:30 or 10, but definitely not beyond that. So 6 to 9 is the sweet spot that we're trying to. Timing of live class, I've answered it. It will cover most topics of Harrison. No, not most topics, all topics of Harrison. That's the idea. That's the goal. Not most. All. Should I join or chill right now? If you ask me whether MD medicine versus anything, I am a hardcore believer that MD medicine is the best. Rest is up to you. Treatment aspects will be discussed in detail and about the day-to-day application of treatment. I answered that question already, guys. It will be discussed and importance will be given to common cases. Even in the intro video, I told the same. NEET SS March will be beneficial for us or there is time crunch. So there is a bit of time crunch, I agree. But of course, I told we are planning to wind up by March. So it will be useful anyways. And in fact, 99% of the topics will be covered by February itself. So still you have 1 month for NEET SS. So it's not a big deal. You can still do it. After March, what will be going on in the app? Practical sessions. I told you, no? So it'll be more of practical sessions, OSCEs, instruments, drugs. So those are things that will be going on in the app till the next cycle starts. Will the live lectures be uploaded in the app? Of course, yes. You can watch it anytime. But still, I feel like watching live is the best thing. But if people have missed the live lectures for some reason, there's always a pre-recorded lecture to watch for. Prachi is asking DNB medicine, not so good hospital in Delhi NCR. DNB medicine, not so good hospital. You have to think twice, Prachi. But if your passion is medicine, you can go for it. No worries. Can we open this app on 2 devices? That's the question for the tech team. I'll discuss the tech team and I'll let you know. So right now, they don't allow it to simultaneously open on 2 devices, but we'll discuss the tech team once. Hard copy notes. Right now, we are not into hard copy notes, but we are planning to do it. But right now, what will be done is like whatever PPTs or PDF that faculty takes will be uploaded in the app. We can just write them anytime or you can take them anytime. No problem. How about pre-record lectures? How much is prepared? We are planning to upload some pre-record lectures of mine, especially from oncology. That's what I'm planning to. But it's mostly we wanted to build in the live class format, as I told you. So that's my dream, to build in a live class format. Thank you, Dr. Naveen. Tidbits for medal exams as well. And see, that's what I'm trying to say. All of the faculties, including myself, we are all medal holders. And I need not say like how many medals I have got, but I can say all of my faculties like are all medal holders, and they will be definitely knowing like what to teach you for getting medals as well. I'm very sure about that. Same time, that's what I'm telling you, same time logging in may not be possible. I have to discuss with the tech team. Once you can also put a message to the tech team. So I don't think they will allow a simultaneous login. Yes, emergency medicine. Yes, Dr. Vishal is covering definitely. I'll be doing some topics, but Dr. Vishal like is very good in emergencies. He'll be doing, and he's actually an internal medicine guy, but we wanted him to teach emergencies right now. Private college empty medicine, should we follow this live lecture schedule for everyone? Why you are segregating private versus government? For everyone, it's going to be the same. Is this app for GPs also? Yes, that I answered that question, Nishant, already. It's for GPs and practitioners as well. Regarding infectious disease, yes, of course, we are going to cover everything in infections as well. No worries. Day-to-day infectious disease, yes. ICU infections, critical infections, community-acquired infections, fungal infections, everything will be covered. No worries about that. Decent rank, but it's not good enough on precision medicine. All the best, Mayur. Will the doubts be taken on the app or on Telegram? Yes, most likely we'll be doing the doubts in Telegram also. You can ask during live lectures also. It's all up to you. But we have a dedicated Telegram group. Thank you so much, Prachi. It's up to you, Yash Gupta. That's a tough question to answer. If you are wanting to start studying from the day one to give you motivation and fire, subscribe right now. So why you want to wait for 3 to 4 months? Thank you, Doc. Thank you, Doc. Thank you. Extend the offer for 2 more days. It's not me. It's the lot of things involved. See, I am only a like apparatus. There are so many people who are there working so hard behind me. So I don't know. I'm just showing my face in front of you. There are a lot of people involved. They have been working day and night to make this a reality. So I have to discuss with them once. Then I can say like whether the offer can be extended or not. Yes, it's going to be a regular session. I told you, it's going to be like maybe once in 3 days you get a gap. So of 1 day, then again. I mean, one good thing about this schedule is if you go through the schedule, I made sure that every Sundays are covered. So I don't know whether that's a good thing or a bad thing, but as a resident, I always believe like Sundays are free. Maybe 1 hour in the evenings of Sundays you can dedicate to it, and that will be great. So every Sunday there will be a class. So that's why I made sure that Sundays you have a class, and even the faculties will be free on Sundays, most of them. So that's the reason I put definite class on Sunday. History taking and system-wise examination of first year residents. Yes, it will be there. Anyway, the practical case, it will be covered, Saurav. So why not? It won't be covered. It will be covered. And of course, see, you might ask, some people are asking about the cardinal symptoms and that initial 200, 300 pages of Harrison part. So we are not going to do that separately. I feel like doing separate is not very good. So that's the reason if you see, for example, approach to LFT is a basic part. So that will be done. And you can see dysphagia. Dysphagia is a cardinal symptom part in Harrison. So what I'm trying to say is things will be covered, but not like the cardinal symptoms part is going to be covered separately. It will be covered along with the subspecialties. How to approach residency? I always say Rome was not built in a day. And we are not going to become big practitioners in a single day. So it takes time. So all I request you to have is like the dedication and focus. That's it, nothing more than that. If you're dedicated and you're very focused, eventually like within maybe 3 years or 5 years, depending on your caliber, you're anyway going to get there. There's no doubt about that. Different books saying management differently, how to get it more practical since hospital-based management are different. It's not hospital-based management is different. It's what you follow in your hospital. So many of the hospitals in India don't have that uniformity. That's what I felt. So in India, it's a consultant-based practice and institution-based practice. Many of them don't follow the guidelines. They use the term, in my experience, in my opinion. I don't like that generally because we are no bigger than the clinical trials where you have like 1 lakh plus patients being enrolled. So you're always inferior to clinical trials. So what we can give is only expert opinion, and that really doesn't matter. So you should have evidence. You should follow something called evidence-based medicine. That's my sincere advice. Thank you so much, Sachin. For GPs, 1 year subscription will be enough or not? It's up to you, Shamsul. I'm not very sure 1 year will be enough or not, but you can experiment with 1 year if you want. But if you look at the plans, most of the even if you look at conceptual orthopedics or conceptual surgery, they offer like lesser price as you go for higher subscription. That's always going to be there. So it's up to you. You can decide for 1 year, 2 year. It's up to you. That's very personal. Thank you so much, Jatin. Thank you so much, guys. Thank you so much. Thank you so much, Praveen. Thank you. Thank you. Thank you so much, Praveen. Thank you so much. Thank you so much. Okay. Thank you so much, guys. Here we are. Officially, we are launching Conceptual Medicine. Just look at the case of the week, the ECG of the week session, and that is going to give you a glimpse of how this is going to be. And you can also have a look at the question of the day, image of the day, and the flashcard of the day series. I mean, this is so much of hard work we have put in. Honestly, imagine every single day you get a question, a beautiful case. Every single day you get a good clinical image. Every single day you get a flashcard. Like, unbelievable. And every week you're going to get a case discussion. Every week you're going to get an ECG. Like, it's something very different. Don't worry about it. So, and your course completion is my and our responsibility. So it will be done. Okay? No worries about it. Thank you so much, Praveen. Thank you once again. Thank you very, very much. And any more question, guys? Your views on medicine as a branch for girls and work-life balance. You can. So I believe girls are, even more competent in multitasking compared to boys. I don't think it's up to you. It's up to you completely. It's a personal question. Shreya. Fellowship options after MD medicine, I want to do DM. It's again completely up to you. First, complete MD. So these kind of decisions, Vignesh, should be taken during the 3rd year MD, not right now. Maybe for a 3rd year MD, that time you have to decide what you like, whether you really want to go to DM or you want to do MD plus fellowships. It's totally in your hands. You decide whatever you want. Thank you so much, guys. Thank you so much for trusting us. Thank you so much for being with us. And thank you so much for joining Conceptual. And don't worry about it. We are going to do full justice. And as things keep coming by, you will understand the hard work that we are putting. It's a tremendous hard work that you are putting, seriously. And once the QBank comes, QBank will be rolled in mid-October. You can see the hard work in the QBank. It's like a phenomenal QBank that we're trying to do. And you can, each and every question is going to be a case. And somebody has asked like 1,500 questions, will it be enough or not? You will see yourself. And it's not going to be 1,500. I'm promising you that it's not going to be 1,500. It's the initial first phase. It's going to be 1,500. Within a month or two, it's going to expand to 3,000, 4,000 plus easily. So don't worry about it. Okay. With that, I wish you all the very, very best. And thank you very much for being with us in Conceptual Medicine. And let's rock all these things together. And let's rock your residency together. Thank you very much. Thank you very much, guys. See you all in the live lectures. Tomorrow, the class will be starting by around 7 p.m. That's what my timing was. So I'll be doing some ECG basics. Maybe in the 19th of September, instead of ECG masterclass, something might change because I don't want to push into the masterclass straight away. So I'm planning to do an endocrinology session with Priyadarshini. So that alone might change. Apart from that, like tomorrow is going to be the ECG basics. Okay. All the very best. Good night. See you all. Bye-bye.